role of design in developing of MedTech products. Welcoming you all is a team of people from Majumdar Shah Medical Foundation, Narayana Health, Will Grow. Uh, so to introduce myself, I am Ram. I head the healthcare practice at Will Grow Innovation Foundation. And for those who have been seeing these four logos on the screen and wondering about what these logos are all about, uh, this event is part of the Bionest program. Bionest program is a program which has been supported by BIRAC, and the partners in this are Majumdar Shah Medical Foundation and Narayana Health, who bring in the expertise around the clinical aspects for creating health tech products. And Wilgrow brings in the business incubation related aspects. And together we represent this as a Bionest. And the unique thing at this Bionest being where the incubatees have an opportunity to access the clinical wealth of knowledge and information which is there within MSMF and Narayana Hrudayalaya. And not only that, if they want to do prototyping, if they want to do additional clinical validation, clinical research, etc., I think there's quite a lot of facility for doing that. And from the business perspective, I think the incubation services are being offered by Wilgrow. So that's the Bionest program for you. Today, I think the topic that we have is role of design in the developing of medical tech, medtech products. Now, how does it really gel in with the startup ecosystem that we are in here in India? Today, to conceive a solution in the medtech space and then try to create a product or a solution out of that and validate it, go through the regulatory processes, go through the certification processes, and then commercialize that at scale is a humongous challenge quite a lot of the medtech entrepreneurs are trying to overcome. I mean, all these hustle bustle that they are doing, there are quite a lot of prioritization that they need to work on. They need to choose several of the options along the road, as I mentioned just now. So in all the scheme of things that is going on, like fundraising, going to the market, getting the clinic product validated, getting the regulatory approvals, all these challenges which they are trying to struggle out, where does uh, a process like design thinking or human-centric design, right? Where does this really fit in, right? So that is what we are trying to address in this webinar today. Over the next hour or so, we've tried to answer some of the questions which you may have, which is like, is it important to pay attention to the design process when we are developing a medtech product? If it is important, how important is it? Why do we need to really focus on this? I think those are the corollary questions that one may get. Aside of that, if we agree that yes, having a robust design process definitely makes sense while we are engineering a medtech product. Now, the next question would be, how do I go about doing it? Is there a process? Is there a specific formula? Is there any sort of a guidance that I can get to go ahead in that path, right? I think that is a subsequent question one may get. And again, generally, you would like to know what is a do's and what is a don'ts when you're approaching a process, right? That sort of a guidance, that sort of a direction really helps you manage and optimize your effort and time in order to get your product faster to the market. So all these questions are the ones which you're trying to address today in this webinar. And unlike a conventional webinar where there is a panel and then there is a moderator, they ask questions and they chat about things, we are trying to organize this slightly differently. What we have as a luxury here is all the panelists who are there are people who have designed and developed their own products, either for themselves or for their clients. They have developed products, medtech products, and that wealth of knowledge is something which we want to really harvest in this webinar. So what we would do is we will ask each of the panelists to talk about the product that they have developed, take us through the journey, and also sort of request them to give us the summary, the golden nuggets, as they call, right? The learnings from that journey which they undertook. And that nugget is something which we wanted to serve to the participants here. For doing that, I think we have got an esteemed panel. I think we have three panel members here. To introduce them one after another, I think let me start with Dr. Samarth. Dr. Samarth is a craniomaxillofacial surgeon. He is attached with the Narayana Health in Bangalore. He's somebody who really focuses on craniofacial and facial syndrome surgeries. He works on cleft lip and palate surgery. He is an expert in TMJ pathologies and dental implantology. I think he's a surgeon out and out. And when he's not in the OT, when he's not doing surgery or managing his patients, he spends a significant amount of time with MedTech startups. So he plays a role of mentor to various startups, and he's sort of engaged with the MedTech startup ecosystem as a mentor. So thanks to have you here, Dr. Samarth. Welcome. Welcome to the panel.
Thank you very much, Ram. Thank you.
And the next in the panel is Shivi Kapil. Shivi is a product of National Institute of Design. And post her graduation, she took a very different journey. I think she signed up for the BIRAC SIP Fellow program. So this BIRAC program works like this, like for a year, the fellows are immersed into the particular specialty which they choose. They go into different healthcare system, understand the challenges, understand the needs, and then they try to find solutions for the challenge which they are identified. And this 12-month journey, the BIRAC SIP Fellow program, Shivi did on maternal and child health. And post that, she started her own company. She's an entrepreneur herself. Right now, she is working on one of the largest health challenges that we see, which is stillbirth. Right? It's the MCH space, and she has created some products and some solutions around how to prevent stillbirth. And she's a passionate human-centric designer. So nice to have Shivi on the panel. Welcome, Shivi.
Thank you, Ram. Thank you so much.
Gautam, who's our next panel member, he's also a product of National Institute of Design. And post his corporate life, he started a designing firm called Yuga Design. And he has had an opportunity to work with multiple different type of organizations. He has worked with startups, he has worked with MSME. So all this while he focuses only on healthcare products. And to his credit, he has partnered with various startups, and he has created quite a lot of successful, well-recognized design ideas for various of the startups. So wonderful to have Gautam in the panel. Welcome, Gautam.
Thank you so much, Ram.
Okay, so that's the introduction of the panel. I think we are all set to move to the second stage of the webinar, wherein I would request Dr. Samarth to share his screen and talk us about the product that he had conceived, the sort of iterations that he did in terms of why did he start, what was the purpose of creating this product on his own, and walk us through the whole journey, Dr. Samarth, please.
Okay. Thank you very much, Ram, and good evening, everyone. My name is Dr. Samarth Shetty, and as Ram said, I work at the Mazumdar Shaw Medical Center, Narayana Health. 1 minute. Okay. For those of you who are not familiar with the term craniofacial surgery, this is a branch of facial surgery which focuses on correcting deformities of the skull and the face. So we see most of our patients are very young children and infants who are born with deformities, either congenital or due to some syndrome involvement. And during the course of their growth, they are with us for a very long time. We follow up almost till they are adults, and they undergo several procedures, surgical and non-surgical, to ensure that over a period of time, the deformity gets corrected, and we use different ways to do that. And So in craniofacial surgery, if I were to look at the main milestones in our development, I think prior to 1971, that was when the first scan was available. Surgeons depended a lot on their grasp of anatomy and how well they could visualize the problem, and they worked out solutions based on that. But post 1971, because of the CT scan, for the first time they were able to visualize, section by section the anatomy and how they are positioned in relation to different vital structures and how the shape has distorted. And it also enabled them to periodically follow up how growth occurred. Another major milestone, I would say, is the invention of 3D printing technology. So that started in the early 80s, and since the 90s and the 2000s, it's really picked up. And in craniofacial surgery, we utilize a whole lot of 3D printing technologies, and now the applications are ranging from implantable materials to replace missing body parts. We use a lot of 3D modeling to, beforehand plan our surgeries and to educate our students. We also use them to make very precise guides using which the outcomes of our surgery can be defined and becomes more accurate. And apart from 3D printing, I think craniofacial is one of the specialties where we interact a lot with our non-medical partners, material scientists, mechanical and biomechanical engineers. We develop mechanical devices that can be used to guide bone development in a certain way. So right from the beginning, historically, we are a specialty which has been working very closely with entrepreneurs and innovators. I would say there are three fundamental elements to any design. One would definitely be function. Function is the purpose for which the design has been prepared. And this should fulfill the function that we have set out to achieve. There's no two ways about it. Second is functionality. So how well the design performs in the environment it's meant to work in. So if it's in a clinic, it should be easy to use by the people who are meant to use it. So functionality is the second most important element to any design. Lastly, of course, everybody agrees that aesthetics is important, and very often the best solution to any problem is the simplest solution, and that simplicity is also harmony. The fact that something is aesthetic makes it very attractive, and what is attractive is marketable as well. So this is the principle that we like to follow. I will quickly take you through this particular case we operated a couple of weeks ago. This is a child of about 12 months, and child suffers from a condition called as a craniosynostosis, which is a premature fusion of the skull suture. So what this does is it prevents the normal growth and development of the brain, and because of which the brain tries to push through other parts of the skull. And as subsequent to that, it causes a deformity of the skull. And since the skull is actually related to the face, you also start seeing distortions in the facial anatomy at a very young age. So you can imagine if you don't treat this case at a very young age, when the child is 4 or 5 years old, the deformity is more difficult to treat. The ideal time to treat such case is within the few months of birth. So 3 months, 4 months, that's the youngest we operate. Anyway, because of this premature closure, this is the kind of deformity the child has already developed. You will see the left side of the forehead is quite prominent because the brain is trying to squeeze its way through to the left side. Again, on the right temporal area, there is another prominent bulge. So the purpose of surgery is, one, to correct the aesthetic part of it, but also to allow the normal brain development. So like I mentioned, with CT scan and with software technology, we are able to visualize the bone in multiple views, and we can plan our surgery. We also do a lot of calculations. And this is a child, so even the deformities that you see are just a few millimeters, but they are significant. So if you look at the left eye, it's 6 millimeters longer than the other side. So these precise anatomy is what we're trying to correct when we plan.
1 minute to go.
Yeah. So anyway, in the surgery, we actually remove the deformed part of the skull, and we recontour it in a way that we try to reconstruct and repair the shape. So this is these pictures are immediately after surgery, and you can see there's a significant improvement. But also we notice again that just like before the surgery, the left side of the forehead is still very prominent. This is because there is a limitation on how much you can achieve by just shaping the bone itself. So you need to implement other methods of correcting such deformity. The classical way is to use a helmet. This is like a boxing helmet. And this is conventionally, it is created by a skilled technician who trains in this. And what they do is they create spaces where the skull can expand. And that's how they achieve a uniform, harmonious shape. So in our case, what we do is we work very closely with a 3D printing company called Osteo 3D. And this has simplified the process a lot because me and my colleagues over an online platform such as this, we're able to discuss the different stages of how the helmet should be designed, what other design features we want, even small little details like those holes that you see, that is to allow ventilation and so that it's more comfortable for the child. We make sure that there is enough retention so that the helmet, because children are not very compliant, so you want something that stays on its own and doesn't come off periodically. You can also the level of customization of color and etc. And this is what we achieved. And we, gave the device, and the parents are making sure the child wears it at least 16 hours in a day to achieve the outcome we expect. So what I'm trying to say is, I think in any design, we have to address the three fundamental issues, that is function, functionality, and aesthetics. And another important aspect is to work very closely with end user, because only when the end user's requirements are met, these three elements of design are also fulfilled. Thank you.
Okay, Dr. Samal, thank you very much for walking us through the experience that you had for designing this product, 3D printed. Would you call this as a guide, or what is the nomenclature you give for this? So
this would be an orthotic helmet. So this is sort of a guide which allows the brain to it allows the skull to remodel in a way we want it to. So yeah, it is a guide sort of.
Okay. So the basic message that you're trying to bring out is working closely with the end user, understanding their pain points, understanding their need, understanding the clinical background under which they are working. I think that probably is a very significant approach which works well. Is that the message?
Yes, absolutely. Like I mentioned, to me, the primary function of the innovation should be fulfilled through design. So it is not a solution if it's not addressing the key pain point. Very often, especially in healthcare, we have the resources and the ideas and probably the technology to do a whole lot of things, but the key element lacking is how it translates to the end user, and the doctor or the person, a surgeon, for example, bridges that gap.
Okay, thanks. Awesome. That was helpful. So can we move to Shivi? Can you bring up your screen, please, with your product, with your baby? Shivi, you're on mute. You need to unmute yourself.
Hello?
Yeah.
Can you hear me? Okay.
Yes. Good.
All right. Thank you, Dr. Samath. I think he opened the entire room for conversation, mentioning why how design can actually help and on a human level. And I think the part he talked about the harmony. He talked about that why design is important. So I will touch upon a little bit of why part, that why we should design, and why we should invest our time and effort in design. Um, there's one thing which is very much associated with design, is that that design is expensive. It is something you cannot touch. You cannot, you have to have very expensive, very fancy designers to design or to create something. But that's not true. I'm sure here at the panel, we two of us are designers, and we design. But I'm sure Gautam can also, he can also agree with me that design is not expensive. It is not. And when I say that because as a team, we tried it. We tried that why design needs to be that expensive? Why can't it be like something very, very simple? So as Ram gave a background that what we are doing, we are creating this pregnancy monitoring solution, which can help mothers to predict the risk of a stillbirth. So I'll show you something which we did. So back in October 2015, this is something we created. So this was our very, very first iteration design, where as a designer, I was not involved. I was involved as a team member. It was done by the entire team of engineers, developers, and everyone, because I wanted them to try something out. And can you imagine that this first iteration was done with just 25 rupees? It was having a tablecloth, like a plastic tablecloth, which was lying there, just like that, and some sewing material, just a stitching material where we stitches the chipper thing and the zipper thing. And this entire prototype was created within 25 rupees. That was the very first form of wearable which we created. And you would not imagine this is how our device looks now. So you can see, it is something you just need to start with. There's definitely to reach from here to there. It has been a long journey. I'm talking about October 2015. Now we are in October 2020. So you can imagine there was a long period on this. And if you want to know how we reached from here to there, you can definitely join us any day, and you can just come to our office and just talk to us over a coffee. Uh, so one thing I think which I wanted to break from people's mindset, that design is not expensive. It is as simple. Yes, it is not cheap, it is not free. It needs your time. Even your time has a value. So even if you're not putting money, you are putting your efforts and you're putting your time. And it is ultimately it has certain value. You should also design, because there's something like that only designers can design, only creative. There's something, we always talk that only we are not creative, only creative people can do it. But I think what I've seen in my team and the people around me, that everybody has something which they can give to the product or give to the solution which we are building. So anybody can design. Um, and when I say that, why I say that, because uh, you know we feel that, have you seen your kids around? Have you seen anybody's kids around? And you will see them that they pick something and make something out of it. So it is something that how you look at things. uh, and why anybody can design is just that all you need to find your medium. I'm sure you can see a lot of kids these days playing with slimy. The slimy material has become such a fancy thing. Like in every toy store, you just see a slimy, because it is their medium to express themselves. So all you just need to find your medium. And that medium, because people say that, oh, I'm not expert in this design software, I don't know how to do Photoshop, I don't know how to make things beautiful. But what all you need to do is just find your medium and try any medium. So any medium, when I say, like a paper, normal paper. So just for example, if you want to create something like on a 2D, two-dimensional things, just take any medium which is like paper, newspaper, old clothes. And I've given you an example that how we did it. And the second thing which you can also try, if it is something like a 3D, where you want to create certain shape, like a 3D shape, very, very simple thing which are available in everybody's house is soap. Just take soap and just take a knife and just carve it in any shape you want it to. It's that easy. You don't need any software. You don't need any creative or artistic skills to do it. You can just do it. And the other thing I think I would suggest is spend more time with kids. If you don't have your own kids, find someone closer to your in your neighborhood or in your relative. Spend time with them. And why I'm suggesting this, because they always, if you observe them, you will always find an easier, the coolest way to do things. So if you can observe and if you can try it out, you will get 1,000 ideas. This is something I personally do, and that's something I'm just leaving it to all of you. Try it and see if it works for you as well.
1 minute to go.
And another part is that why you should design is because there's a lot of fear that, because I am an engineer and I do coding, I am a technical person. I'm not a creative person, as I said earlier, but, there's this fear around it. There's certain things which stops you. But what I personally feel that you should design because design makes you courageous. It gives you, I think, certain edge. Just like Dr. Samad said, like, he's a doctor and he's still design, and everybody design Gotham, and I'm sure most of us, and in the entire community, in the MedTech community, the people I know, not everybody is designer, but they are all designing wonderful, wonderful products. So it makes you courageous. So you should do it. I'm sure this is like a very relevant image for all of us. We all have been there. And I'm sure you can agree that we have been there at at least once in our lifetime, right? But what it is, we see it as a failure, as a discarded, idea or something, and we feel that this is done and it is not possible. But this is like an image for me, has been an inspiration, and that's the reason I'm sharing it, because I always felt that every time I created something like this, I actually moved a step ahead, you know. So imagine if you do something like this, where would you go? So just do it multiple times. And there's one thing which I really want to stress upon is that design, it teaches you the reason behind it, like why you are doing what you are doing. Because when you focus on the what part of it, it becomes boring. It is not long lasting. Once you achieve the what, then your journey is done. But when you chase why, it becomes really, really interesting and you never stop. So that's why I think you should focus on the why part and not the what part. So that's the reason I'm pushing that, you should design, because design, it only helps you to gain, and you never, this is the only thing, it's the only space where you never lose. So please design and just leave your creative, your entire designer in you, just leave out there, just free that designer in you. That's the message I will leave with. Thank you.
Thanks, Shivi. That was very interesting. So what you're primarily trying to communicate is don't hesitate, shed your inhibitions, and try it out,
Yes.
right?
Yes.
And the second message that you're saying is don't get too much focused on the what part and focus more on the why part. So why opens up more opportunity to be more creative. I think that's the message that you're trying to put in here.
That's correct, Ram. Yeah.
Okay, thanks. Thanks very much, Shivi.
Thank you.
So Gautam, can we have your...
Am I audible?
Yes, Gautam. Yeah, go ahead, please.
Yeah, thank you, Samarth and Shivi. It was really great presentations. It was very fascinating to hear and see your presentations. So I'll just start with mine. Just a minute. Is it visible now?
It is. It is. You could make it full screen if it is. Yeah. Great.
Okay, so I'll just introduce first myself. I'm a industrial designer and I have been associated with medical tech design from 2009 onwards. We had first started our project designing the Smart Kin, which is a wayfinding device for the visually impaired with IIT Delhi. And then from that's how our journey began into the healthcare sector or assistive tech, those kind of devices we have done a lot. And we are till date, we have done about 30 products which are in market. This year, about 3 products are getting launched. We have clients all over India and as well as abroad. We're basically a product design consultancy. We do product styling, ergonomics, human factors, full-scale product development. Okay. So what I'll be showcasing here is a product that we had done for one of Will Grow's startups itself. It's a company named Yostra Diagnostics, and they had developed a product for diagnosing the peripheral neuropathy. Basically, what happens is for people with diabetes, over a period of time, if the cases are very severe, the bottom part of the feet, the nerve ending starts dying, and they lose the sensitivity of the bottom part of the feet. So this is a device that helps to diagnose those symptoms. So I'll give you one example. There was a patient in the Gulf who was sitting next to a pot of biryani. While sitting, he was not aware that his leg was touching the hot pot. By the time he realized, his flesh was completely almost burnt off. That is because he didn't have any sensation in that area. Okay, so this device is meant to diagnose earlier, to screen basically earlier itself, to catch it before it creates more problem. So the client had approached us because they had a prototype with them, a device which was not giving them the result that they wanted. Basically, there were a lot of ergonomic issues, and this was already done by an industrial design agency, but it was not satisfying the user as well as the stakeholder. By stakeholder, I mean doctors, clinicians, marketing people, vendors, all come under stakeholders. And the main stakeholder in this is the user on whom we are going to use the product. Now, the product has to be comfortable for both the user, the patient, as well as for this main product user, that is the doctor. So over here, you can see we are testing the product with Dr. Sanjay, who was also the partner of Yostra, and who helped us with validating the existing product. Okay, so we start with validating products that are already there in the market, and we also try to see how those products are not addressing the pain points of the users. Okay. So over here, you can see a very simple thing. Okay, so this device over here has got a hot probe and a cold probe right at these two ends. Okay, and it's got this vibration sensor over here, a pin over here that is supposed to understand whether there's good tactile feedback in the feet. And there's a monofilament over here also, that's also meant for tactile feedback. Now, the hot and cold probes that you see over here are so much in the extremes of the product that you can see the doctor's hand bending over here. Okay, so the more amount of time the doctor spends with the product, the patient might be diagnosed, maybe screened for about 10 minutes, less than 10 minutes. And throughout the day, he's keeping on screening patients. Imagine the repetitive stress that's being developed over here. Okay, see how the doctor is crouching over here to test on the patient. Yeah, so a lot of issues, ergonomic issues in posture. Okay, and also all the diagnosis. There are about 4 features in the product that have to do a particular function, and all of them are on the same plane. You can see it over here. So while I'm getting a vibration tactile feedback testing over here, you can see there's another monofilament that is hitting the patient's leg. Okay, so 2 functions are in contact with the patient's leg at the same time. So this causes a lot of confusion for the patient. Okay, so having all the functions on the same plane causes problems with functionality, usability issues, right? So it is always important that as an entrepreneur, you first understand the pain points and existing usages of products, examples of products that you can find in the market before you go into directly full-fledged designing the product. Yep. Try to understand the user first. So based on the feedback that we got from here, we went on to redesign the product, for which we developed a lot of clay models. Okay, and you can see here for each functionality, we have given a different holding style. Now, in the previous product, if you see, the holding style is more of that of a sword. Okay, whereas our holding style is more of that of a rifle. Okay, which is one of the most ergonomic designs. So this is very comfortable for the person to use. So we have over here your hot and cold probes. Over here we have the vibration sensor. Okay.
1 minute to go.
Over here we have your thermometer, infrared thermometer. Over here you have your monotype filament pen type holding style to get more accurate and sensitive data, right? So these are the types of holding styles that we had come up with. We tested this then on the patients at the doctor's clinic and also at Manipal University. We had about a 31 user test and minimum user test, but we went on even further. Then during the test, we also tried to figure out how to reduce the hardware size to best fit the form and functionality. So we were able to reduce a particular component's size by almost half in order to fit in this form factor. Okay, so we do a little bit of hardware design changes also. It's not just about the form and fit, but for the best form and fit, you need to look at the hardware. Now you see the style over here of holding. This was validated. This was rejected during the validation process, because over here, what is happening is in this style, when you flip the device, there's a lot of weight over here that's happening on the arm. So hence we decided to chuck this idea, and we decided to bring this monofilament to the front. Okay, after that, once we were satisfied with the user testings of the mock prototypes, we went ahead with the 3D scanning, after which we did the 3D modeling, and then the prototyping, which is the 3D printing, which is in SLS or SLA, FDM, whatever medium possible, but we would prefer SLS and SLA because they're more finer and gives better ergonomic feedback. FDM has a lot of issues with it. And then this is our final product where we did the vacuum casting, and we did a 25 batch production, and that went on to user trials. Thank you.
Thanks, Gautam. That was wonderful. I thought you will mention the fact that this particular design also went on to get some awards. So maybe that's something which is a feather on your cap. I think you should talk about it.
The product actually went on to win the NASSCOM Design Award in 2018. That's best design award, best award for ergonomic design in India. So I think it's got some other couple of awards also, but I'm not aware of it.
Okay, to summarize, Gautam, what you're saying is collecting that user insights, right? That research around how the product is being deployed in the clinical environment. Does it match the expectation of the physician or the user, whoever is concerned? And how does the functionality really work with in that particular clinical environment? I think all this user feedback, insights, that research is a very critical element that you're trying to bring out in this particular case. Have I understood that right?
Yes, and it's also a very iterative process. You keep iterating on the feedback based on the clinician, what he's giving or she's giving, and also what the user is giving. So a lot depends on your observation skills. So you have to observe without any bias. The moment you have a bias that the product should be like this, it should be aesthetically good, only then I can market it, I cannot fit this form function, it'll create a problem in the aesthetics. No, that's not the way to go. Aesthetics has to be a default, and we have to focus on the functionality. If you focus on the functionality, your product will definitely sell. To help the product sell even better, you focus on the aesthetics, but the functionality has to be successful.
So essentially what you're saying is the first attention is to ensure your functionality is fulfilled. Next comes the aesthetic part. I think in terms of priority, you're talking about keep the functionality high, and then the next would be the ergonomics and the aesthetics. Is that the message?
Yes, exactly what Dr. Samarth had said. So without functionality, say you were to design a product that's very aesthetically pleasing to the eye and all that, right? And you release it into the market. The moment people start using the product, it's going to fail miserably. You're not designing a sculpture that needs that you're not doing art over here. It's design, it's functionality, form and function. It's both cannot survive without each other.
Super. I think two messages until now which have come very clearly. I'm sort of summarizing what Dr. Samath talked about and what Gautam you talked about is keep the user at the focus. I think that is one of the first principles when we talk about design thinking, right? Keep the user in the center, keep them at the focus, understand the environment that they are working in, and then design the product to ensure that particular user environment characteristics are fulfilled. I think that's one clear message that's coming out. And the second part that we're talking about is sort of functionality is very, very important, no compromise. And that functionality, if it performs very well in the user environment that we're talking about, that is probably the route to success, route to your commercial success is something which is coming out until now very clearly. Have I summarized this until now well?
Yes.
Okay,
Yes.
cool. So if you can just jump into some more questions now that the presentation part is over, right? Wanted to ask this question. Maybe Gautam, you could answer this here. From a startup perspective, from a MedTech startup perspective, right? When exactly do they start thinking about these design processes, right? Which stage of the product development? Is it at the idea stage? Is it at later stage when they are having their first proto? Or is it about a journey between alpha and beta? Where do you see this whole design process per se really panning out for a startup? What is your thoughts around it?
So the design process as such begins right at the start of idea generation. So when you're trying to identify the pain points, or you're trying to bring about a product that's going to solve a particular need of the patient, or any pain point that you're trying to address, right at that point itself, the design process has begun. It's already started. Without whether you name it as a design process or not, it's already started. So right at the idea stage, that's what I would go with. And it goes on even after the product is released into the market. You have to go and look at how your product is performing in the market by talking to the customers, by talking to the vendors, by talking to your service engineers. What can be done to improve the product? All these things comes into play. Talk to the clinician, how we can help reduce the number of steps, to implement the product usability better. All these comes into play.
So essentially what you're talking about is in the initial stage, it starts at the idea level. And when it is at the marketplace, the feedback loop has to continue, wherein you're picking up insights from various stakeholders. And if there is a possibility for you to bring variants or your improvements on a continuous basis, right?
Exactly. You're not going to stick with just one product. You're going to improve on that product. It's always best to reach the market as fast as possible, but you have to improve after that. You're going to come up with your version 2, version 3 in the 5-year or 10-year lifespan.
Okay. So thanks, Gautam. So moving on to Dr. Samarth. So again, we talked about it earlier, right? Keeping the physician in the focus, right? And understanding their need, et cetera, is very important. But unfortunately, if you look at a startup ecosystem, right, very seldom do they have the access of having a clinician in their team, right? Whether it is a surgeon or a physician, whatever be the case, having such an individual, how does it impact? Or on the opposite side, by not having the right clinical partner, what could be the potential risks? What would be your thoughts around that?
Yeah. So I think, like Shivi mentioned in her presentation, which was very inspiring and excellent, the first step when you're trying to address a problem, the design element comes from the innovator themselves, because that is the starting point for any innovation, because you're trying to do something in a different way um, than conventional. Then the design process starts with the innovator. The point at which they come to reach out to a clinician or a expert or like someone close to an end user, I would say would be at a stage of early prototype. So we clinicians don't understand technology that well. So we kind of know what is the solution, but if we have something in a physical form, it becomes more easier. So I would say if somebody comes to me with a prototype at least, and which on which they can build up further, saying that this will be a more refined, and so on that it's easier for us to give inputs and what will work or what may not work. So certainly I would suggest that build your own design. The first step should be done by you and the way you conceive it. And then for a refinement stage, you can come and reach out to any of the clinical experts.
Awesome. Thank you. Thank you, Dr. Samath. Over to you, Shivi. Another important principle which is being talked about when we talk about design thinking process or human-centric design is having this multidisciplinary team. I think you alluded that in your presentation also. So again, looking at it from a startup, health tech startup perspective, right? To have all these people around the table, right? A mechanical engineer, an electronic engineer, a design guy, the physician, all around the table is going to be a humongous challenge, right? Resources are constrained. Ability for having the skill around would be very limited. So how do you think this can be overcome? Are there any thoughts? Are there any suggestions from your old stories you want to talk about? How do you manage this multidisciplinary team, which could be potentially a challenge for quite a lot of the early stage startups?
I think I'll speak from my experience, like what I have gone through, and the tricks which we tried. So one thing which we set like a what do you call, the culture in the team is that doctor would not just be a doctor, so or a designer would not just be a designer. You need to just bring more to the table, and that's the first thing which breaks that, this entire mindset that, no, I'm the creative head, I'm the creative person, and I would not contribute to that. And when you sit around the table and when you talk about just one thing in the center, you bring your everything. A doctor brings a user as well, like how the doctor communicates to the patient. They also bring that how I see my patient, how I see my patient's vulnerability. So when you set this thing in the team, it kind of breaks that entire mold, and it actually worked for us. What all you need to do is just continue this thing every day. So what happens, it's not like you just create like a day in a year, but you need to try this out every day. And I think it works. It worked for us really wonderfully. All I enjoy, like most of the, we have created 13 iterations of our design till now, and I'm telling you, most of them were designed by the team. I just contributed like a spectator, and then okay, yes, this looks cool, because I didn't want, just like Gautam also mentioned, the bias part of it. I think becoming or being involved in the process, we obtain this certain bias in us, and I think we need to stay away from that if we want to really design something for the practical environment. So that works for us wonderfully, and that's something I think everybody should try.
Okay, awesome. So primarily what you're saying is people wear multiple caps, a mechanical engineer also playing electronic engineer role, the electronic engineer playing a designer role, and the designer playing other roles. I think that multi-cap thing is what you're really talking about.
And I think you should also invite these people to open up. Like, you should create that environment that, yes, just show us other colors, show us what else you have got. And even the interns we hire, all the interns, I never ask for their like a CV. I always ask them, what else coolest thing you can do? Just show me everything, you know. So that's something, it helps you to break that part, and you see that, okay, this person is not just a coder, he's also something very, very cool who can bring to the table. And then I hire that intern. So,
Awesome.
you know, it works that way.
Cool. That's very helpful. I think again, in a resource constrained environment, this suggestion which you gave is really powerful. That's welcome. So Gautam, when an entrepreneur is really planning for this design process, you talked about gathering user insights, we talked about multiple iterations, etc., etc. So on a ballpark basis for a medtech product, let's say point of care device, right? What sort of a budget, what sort of a number they should look at in terms of in their planning? I think end of the day, most of the health tech startups, it's like a hand-to-mouth existence. They are cash trapped, so to say, right? So what would be your sort of a ballpark number, which you would say that this is a number we should look at in terms of budgeting for this whole design process, including the user insight study?
So I think most companies are right now, especially in collaboration with Willgrow, are in a very unique position where they have good access to hospitals for validating their ideas, and also they have good access to mentors. So if that's the case, then I don't think you would require that much of funds. You can even go ahead with hiring intern for design. And if the entrepreneur is not that sensitive to design or understanding the user-centric approach, like over here, Shivi is very fortunate that she has a design degree in her background. So she's very sensitized to that. And so that reflects in her team also. Now, if you don't have an entrepreneur like that who's not yet sensitized, find somebody, find a mentor who's sensitized to that subject, and try to hire interns. Use the mentor to even hire an intern, right? And try to put that person as a part of your team, give them, collaborate and work as a team to come up with a proper first initial proof of concept, right? Now, for that, I don't think you would require much of funds. I think in about with a team size of say 4 to 5 members, plus Willgrow's help for getting in the clinicians, I think you can look at about 5 to 8 lakhs as the budget until you
Okay.
get your proof of concept.
So this would include your user insight study that we talked about.
Yes,
I think
yes.
ballpark. Okay.
Yeah.
So you're saying 5 to 8 lakh is what you need to really look at in terms of budget for
Yeah,
looking at
and
the whole design.
I'm talking about a timeline of say about 6 months.
Mm-hmm.
Yeah, this
Okay.
I'm talking about a product that you're building from scratch, huh?
Right.
Not
so
something
what all will we be able to achieve in the 6 months time, right? In terms of blocks, what are the few blocks that we will be able to do in the 6 months?
So in the first, what you'll be able to do is you'll be able to find the pain points of the user that you'll do by your observation and the general user studies that you'll be doing along under the guidance of your mentors or your design practitioners in-house. And it would be great, actually, if I would just want to point out here that if the entrepreneur can go through some design sensitization course or something like that, you know, that will help the company to be more design driven, right? And then after the user study, you go ahead with building frugal technical prototypes, okay? And you test it internally within the team. Go and show it to your clinician. Right? Is this the result that is expected? If the clinician is happy, then you go and test it on some more users. You might never know that clinician might be even open to testing on their own patients if he's happy with the results, with the technical prototype itself. Once you're happy with the technical prototype, you go ahead with building concepts. And for concept generation, you just need a person with some good 3D knowledge, and you show how the end product is going to be, the vision for the product. Right? You don't have to build the product right then and there because you're not having the funds for doing that. You take that concept design and your technical physical prototype, right, and show it to the investor. That's when you raise the next round of funds.
Okay, good. Thanks for walking us through the whole journey, because this is very interesting, right? the proof of the pudding is eating it. I think end of the day, two clear things have to be achieved with your product. One is your commercial success. Obviously, getting the investors' money, investors' check is also a very important part of that particular journey into growth, right? Great. Thanks, Gautam. That was wonderful. So, Dr. Samath, I'm going to ask you a very sort of a different question here, right? If in case somebody doesn't really keep the user interest in mind and sort of not walk through this design process, what do you think would be the challenges, or what do you think is the risk that they will end up with? If you don't follow the design process, you do an ad hoc product development, what will be the downside?
From my own experience, when I think this has happened several times, it does happen very often because most innovators, they have a brilliant idea and they think that just the idea being very brilliant is enough for it to succeed. The second part of it is functionality. So the product should do well in the environment it's put into, and it should be, it should serve the purpose. A big chunk of it goes into if the person who's supposed to use it is willing to use it. There are technologies where doctors are expected to use it in their clinics, but you know how in India, the outpatient clinics are just flooded with patients. So unless it's something which is very quick and efficient, the end user will not spend that much of time and resource to just make it work. So in this stage, what happens even before it goes into a prototype validation or a proof of concept validation itself, you cannot go beyond that point. So, I mean, a lot of innovators come to that stage and then they have to go back and then redesign. So it just, it's an extra expense on the already cash-strapped startups, sort of say.
Yeah, not only the money part, but also the time, the competitive edge that you have to go into the market early. I think all those probably will be lost. Yeah,
the idea is pretty much out in the open, so it doesn't take much time for somebody else to.
So do it right the first time is what you're saying, right? That's MSA, right? Learn very fast, fail fast, and learn fast.
Yeah, especially with MedTech. Of course, if the innovator itself is, he knows the field and he's practicing clinician, not just clinician, it can be a diagnostic device. But if somebody, the innovator themselves know about it, then it's a different situation. So they probably have a higher probability of getting it right at the beginning. So it depends on the innovation also.
Agreed. Good. So
I'd just like to point out one thing. So in the design field, we have this statement that keeps floating around. When customers say that design process is too expensive, I don't have the time for that. I don't have the time for doing user study. This is very common in the consumer electronics market. Okay, if you don't have time for the design process and you don't have time to build a good product, you should know the cost of a bad design. It's very expensive. A bad design is very expensive. No design process is equal to bad design, which is equal to more expense.
And to failure, maybe.
Yes.
Okay, thanks Gautam for chipping in. So one other question which I want to raise here is about the DFM, right? We talked a lot about prototype to the idea to prototype and MVP stage. So when going into manufacturing, how do they translate these design into a DFM, like something which they can continue manufacturing and things like that? So Shivi, you want to really add up any thoughts around DFM, the thoughts around DFM? How do they approach DFM per se as a MedTech startup?
I would like Gautam to answer this because he is a more pro to this. And I will add to what Gautam says. Yes, I would love to hear his thoughts.
Nice of you, Shivi. Yeah. Yes. So Gautam, back to you.
Thank you, Shivi. So I'll just say that you'd have to have a seasoned production engineer within your team. That's the first thing that you'd require as an entrepreneur. You'll have to have that one particular member in your team. If you're not able to have that particular member in your team, there are a lot of certification agencies that provide certifications, and there are a lot of particular ISO certificates like your ISO 14971 and your ISO 13485. Yeah, these two are the main certifications that you'll require, mostly in the MedTech field. So you can get some certification members and build your product according to those steps. And by the time you reach the end of the design cycle, you will have a product that is designed for manufacturing once you start addressing all those certifications.
Okay, cool. I think we are more or less on time. I have one last question, right? See, another in MedTech, there is one critical challenge, or the one sort of a barrier that we have is about the regulatory angle, right? It's a very critical sign off or a milestone that need to be managed. I think you brought in sometime earlier, Gautam, on the serviceability part, right? You may make a wonderful design, you may have a great, awesome product, it may be functionally great, it may look aesthetically awesome, etc. But when it goes to the service, when the service engineer has to open up and sort of do a post-sale service or maintenance, they start fuming, saying that quite a lot of the components are completely inaccessible, right? Servicing becomes a pain. So how do you factor in the regulatory and the serviceability angle? Uh, Anybody wants to answer between all three? Whoever wants to take this question.
So that is actually a part of the design process. The particular pain point you're talking about, the service engineer is going to face in the future after the product is started to manufacture, and that's actually too late to identify that problem. That's something you have to early on identify while you're designing the product itself. How are they going to do the assembly of the product? How are they going to access the product when there's some service issues? How are you going to replace the device? Do you have enough components in stock? All those will come, especially in those, the previous I was talking about those ISO certification parts, right? All that will address that automatically. You have to fill those particular rules, and once you fill those things, you'll get a better idea on how to build your product.
So integrate all these components as you process your design ideas, right? I think
yes. Serviceability of the product is a part of your design exercise. It cannot be an issue after you release your product to the market. If that's the case, then you have failed one stakeholder, which is your service engineer.
Awesome, great. So good. I think we are 5:03, so we have just crossed the timeline by 3 minutes. So I would sort of wind up here, and maybe one last comment from each of you on emphasizing or a takeaway message to the entrepreneurs, potential entrepreneurs who are there in this call. What would be your one last piece of advice? So you want to start with Dr. Samarth?
Well, my advice to an entrepreneur would be to keep innovating on your design. So I think the first step is to start designing it yourself. And like Shivi and Gautam addressed, work on multiple iteration till you understand your product. And also, I think, I at least the ones that I have worked, I have gotten to know the innovators at a later stage. But if it's possible for you to have either a friend or a family member to look at your device and advise you right at the beginning, it can save you a lot of pain going forward, and it can optimize your design better. So always focus on the end use, and whatever resources you need, reach out to the right resource and make sure your product comes out well.
Okay, good. Thanks. Over to you, Shivi.
I think what I would suggest is that to design, you don't need any reason. I think design anyway. Design without having any very, 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 strong reason. Just design anyway. And I think one thing which I will also, share is that meditate over your design. Just sleep with your design, whatever is there. If you can sketch it, just sleep with it, and just see it in the morning, and you will have some new thought. Earlier I used to use this word obsession. So I used to be the person who was obsessed with pregnant mothers. You would not believe how many times I was stopped by my team that do not go there and ask, because I felt so comfortable just seeing pregnant mothers around, and I felt like they are my family and I can talk to them. So but that actually helped me to understand what kind of things parents during their pregnancy, what kind of things they go through. That made me understand who's our user. And it's not just the mother, it's the father we never spoke about. Father is the person who's sitting outside the hospital waiting for the good news. But he's not just that person. He is also involved in the entire pregnancy period. So I think you don't need the reason to design. That's one. And second, just do it. And this is the time to design. We are living in the time of pandemics, and it's not just a crisis, it's an opportunity for us as well to design. And it's not just for pandemic but beyond pandemic, but it's not, because it's not going to be there the whole time. So what would be the better opportunity to design better? So do it anyway. Yeah.
So passion and need assessment, I think that's your message.
Yes.
Obsession to need assessment.
I would not use the word obsession now. I think I learned a vocabulary for this, that you meditate over your idea, and you would know, you would find your path. Yes.
Awesome. Over to you, Gautam.
Yeah, it's pretty much the same what Shiv is saying. So you need to, as an entrepreneur, you need to spend more time with your user and all other stakeholders, understand their pain points. Again, why I keep coming back to understanding the pain points. Once that starts, automatically the design ideas will flow into you. You will, Indians especially, have this jugaad mentality, which is not that good a term to say, but that's how it is right now for building a first technical prototype, right? For your first proof of concept, it'll be mostly a jugaad work. You might take up off-the-shelf components. You might take up something that are there from other products that are there on the market, and you'll tinker with it. You'll try to make your proof of concept, but always keep in mind, you are addressing the need of the user. Without the user, your product doesn't exist. Your company doesn't exist.
Awesome. I think that was very powerful. I think we literally covered the important salient aspects of design thinking process. We talked about customer at the core. We talked about multidisciplinary teams. We talked about keeping functionality at focus. We talked about keeping all the regulatory, serviceability, all the design related parameters that need to be incorporated. We talked about the fact of the user insight, the valuable insights that you would get through the user insight or the user research that we talked about. We talked about that the design process should start in early and it doesn't end even when the product is there in the marketplace. I think to a fair degree, we have been able to cover the significant points around the design and the design thinking process that need to be incorporated in a MedTech product development. So thanks the panel members. Thanks, Dr. Samar.